Thank you. Good afternoon, everyone, and welcome to the Assembly Committee on Health and Human Services. Madam Secretary, can you please call the roll?
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen. Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Wynn.
Here. And if we can mark Assemblyman Hafen present, absent, excused, and I believe he is on his way, so when he arrives, if we can mark him oh, look at that. There he is. So he is present. So we have a full house here today. So welcome to our audience joining us for this meeting, either online, in person, or by phone today. We have 3 bill hearings on today. And before we begin, I'd like to make several housekeeping announcements for all individuals that are present in our meeting room. Please try to keep your face covered and maintain social distancing as best you can coming in and out of the room. Additionally, members of the public may provide testimony in various ways, all of which are listed on the agenda. If you wish to submit public comment, either in writing, in addition to, or in lieu of testifying, written comment, public comment may be submitted before, during, and up to 48 hours after the meeting's adjournment. And finally, if you have your electronic devices, now that we're in the room, if you can mute them so we don't hear all those dinging and bells, as well as your cell phones and laptops in silent mode during the meeting, that would be greatly appreciated. And with that, we will move on to our first agenda item today. We are going to start with Senate Bill 61. So at this time, I will open the hearing on Senate Bill 61. It revises provisions governing the program for the operation of vending facilities by licensees who are blind. And I believe presenting today, both on the Zoom, will be Chris Sewell and Chris Mazza. Is that correct? Yep, I'm getting some head waves here. Wonderful. I'm not sure who is presenting first, but I will turn it over to each of you to begin your testimony when you are ready. And please, I'll remind all of our presenters, co-presenters, and people testifying in support, opposition, and neutral to please clearly state your name before you speak each time, just so we can make the lives of our amazing staff here a lot easier to do the minutes. So begin when you're ready.
Thank you, Madam Chair, members of the Assembly Health and Human Services Committee. For the record, I am Christopher Sewell, Chief Operating Officer and Legislative Liaison for the Department of Employment, Training, and Rehabilitation. I'm here to assist in presenting to the committee SB 61. Administrator Shelley Hendren is going to be presenting this bill, but due to an emergency meeting with LCB Fiscal, the bill's details will be introduced by Chris Mazza, Chief Enterprise Officer in Dieter's Rehabilitation Division. With your permission, Madam Chair, I would like to turn the presentation over to Mr. Mazza at this time.
Thank you. That would be fine. Mr. Mazza, please begin when you're ready.
Thank you very much. Good afternoon, everyone. As Chris Sewell said, my name is Chris Mazza. I serve as the Chief Enterprise Officer for the Business Enterprises of Nevada, or BEN program for Dieter's Rehabilitation Division. I'm here to present SB 61, which proposes changes to NRS 426, the statutes related to the Blind Business Enterprise of Nevada BEN program. Briefly, the BEN program provides entrepreneurial opportunities for individuals who are blind to own and operate vending facilities in public buildings and properties. These vending facilities may include vending machines, cafes, cafeterias, cart services, micro markets, and gift and sundry shops. The program was established with passage of the Randolph-Shepard Act in 1936, which gave priority of right to blind licensees in federal buildings and properties. States across the nation then created state statutes, often called the Mini-Randolph-Shepard Act, mirroring the federal law within state law. In fact, Nevada statutes have existed for more than 60 years. The state statutes provide the priority of right for blind licensees in state, local, and municipal buildings and properties. These programs exist because blind individuals are employed at a rate of 52.3% as compared to 78.2% for those without a disability. Blind individuals are in poverty at a rate of nearly 30%. In Nevada, our blind licensees own and operate over 400 vending machines and 29 sites statewide. During typical times, they employ over 100 Nevadans. Currently, due to the pandemic, we are about half that number. Some sites you may recognize include the snack bars at many DMV locations, the Hoover Dam Cafe and Mercantile, and the Caucus Deli at the Legislative Building in Carson City. With the proposed changes within SB 61, we hope to 1, provide clarity to the law's intent, 2, define terms and use them consistently throughout the statute, 3, align state law more closely with federal Randolph-Shepard Act and federal regulations, and lastly, add a new section on training, which is in Section 2. Section 3 is a rewrite of our dispute resolution process. The prior process placed the DETR director as the decision maker in disputes and even potentially involved the governor. This new section provides for a more formal, uniform, and objective means to settle disputes between the Bureau and any public entity partner through the state's hearings division. DETR's administrator has spoken with the senior appeals officer with the hearings division, and we have their support for this addition to our statutes. I'd like to move forward to Section 6. As you can see, we've added several new definitions. We think it's important to clarify these terms and thus clarify the intent of the program. I want to specifically point out the definitions in subsection 4, 5, and 6. Subsection 4 is the definition for public building or property. We wanted to clarify the intent of the priority of right of our blind licensees. To do so, we included public entity as defined in subsection 5. We modeled our definition for public entity after NRS 286.070, which defines a public employer. Subsection 4 also includes exceptions for those meeting the definition, but who would be exempt from participating in the BEN program. 2 new exceptions were added with the amendments. The first is for an airport authority operating in this state and a Department of Aviation, which is operated by a political subdivision of the state. The second exception is due to the fact that we are seeing new public-private partnerships, especially in and around Las Vegas, and based upon some concerns that were raised by public entities, we added this exception for any public building or property used for live entertainment purposes as defined in NRS 368A.090. Subsection 6 defines vending facility. This new definition is taken directly from the federal regulations 34 CFR 395.1X and was done so to add clarity. Section 7 includes new language to further explain the meaning of licensee's priority of right, including the right of first refusal in subsection 1A. Due to concerns raised by sub-public entities, the amendment in Section 7, subsection 2, added further clarifying language related to waivers, stating waivers shall set forth the condition under which the waiver may be revoked or modified. A concern was raised about Section 7, subsection 1A, which states that if a public entity has an agreement in place for which the Bureau notifies it that it intends to exercise its priority of right, that agreement is null. However, it is not our intention to retroactively break contracts between public entities and their vendors. The amendments included limiting this ability to the period after passage of SB 61, if approved, and not retroactively. SB 61, as amended, proposes to change the notification period in Section 8 from 30 days to 60 days. This was a compromise with other public entities from our originally proposed 90 days. A 60-day notification period is the same notification period required in 34 CFR 395.31. Now I'd like to jump to Section 11, NRS 426.670. This is a heavy section of law that contains details on surveys, establishing vending facilities, the Bureau's ability to create regulations, and costs that shall or shall not be paid by blind licensees. Subsection 1A details the survey process. The Bureau would conduct a survey of the potential site to determine if it might be a viable site for a blind licensee. If so, subsection 2 details the necessity for cooperation from the public entity to establish the vending facility. Amendments to SB 61 in this section address a concern that was raised that the Bureau could insist on the vending facility whether the public entity wanted it or not. The amendments include that the public entity shall cooperate with the Bureau to discuss options for a vending facility, and if an agreement is reached, shall cooperate with the Bureau to establish one or more vending facilities. SB 61 adds more detail to our ability to create regulations in subsection 4 of Section 11. The added language is taken directly from the requirements within the federal regulations. Subsection 5 distinguishes costs that shall be paid by licensees and those that shall not. These are taken from the Randolph-Shepard Act, which puts constraints on what may be paid out by the licensee's set-aside funds. In subsection 6, we added the ability to pay incentives in the rare instance that it might be appropriate. This is the only payment outside of increased utility costs where we may have flexibility. The term has been borrowed from the state of Tennessee's Minnie-Randolph-Shepard Act, where it is in use in their agreements to run commissaries and county jails. Section 12 adds a description of management services in subsection 3, which are allowable to be paid out of the set-aside or enterprise account. This is the federal description. The change in subsection 5B regarding the portion each licensee would receive if the program was liquidated was determined and agreed to by the Nevada Committee of Vendors Who Are Blind. Section 13 has added language that ensures a continuity of services in a vending facility should the blind licensee have a period of disability or permanent disability. It outlines what would occur, including that the Bureau would run the site until the licensee was able to return up to 6 months. And lastly, I'd like to call your attention to Section 19, NRS 426.715, is the penalty section of the law. A concern was raised that according to this section, public employees could be guilty of a misdemeanor for ordering a sandwich from a sandwich shop or a pizza from a pizzeria, and that the delivery drivers of that sandwich or pizza could also be guilty of a misdemeanor. This is not our intent. Therefore, amendments in this section are to alleviate this introduction of SB 61. Thank you very much for your time. Chris and I are available to and happy to answer any questions that you may have.
Thank you, both Chris's. At this time, we do have some questions from committee members. So I will start with Assemblywoman Titus.
Thank you, Madam Chair. And thank you for presenting the bill. I have questions regarding Section 7 of the bill. And under Section 7, number A, and that's Section 7, it talks about regarding that the Bureau has the right of first refusal for any operation of any vending facility in any public building or property. So throughout the state of Nevada, there's many public locations in very rural areas and very urban areas. So before somebody can put a vending machine in, all applications will have to go through your office? Question?
Thank you very much for the question. And I'm sorry, Chris, did you? Oh, okay, thank you very much for your question, Assemblywoman. Yes.
Can I get
that
you
is,
to
in
state your
fact,
name for
key.
the record first?
I'm sorry. This is Chris Mazza for the record, then Chief. Yes, that would be the case. If you want to put in a vending machine in a public entity building, you would first come through our office. In the case of some of our, I'm sorry, go ahead.
Anyway, thank you. When I'm reading this, it says a public entity or any entity that receives public funding. And I guess my question was really, so you answered that, yes, indeed, that would happen. Do you have the capacity to do that? I mean, that could be hundreds and hundreds of building locations potentially that you would have. What would be the delay in that process? How long does it take? And how competitive is it? Do you get to take whatever percent of profit that you have and nothing goes back to the entity where the building is, the vending is? I need some clarity on all of that.
Okay, thank you again for your question. This is, for the record, Chris Mazza. If you are referring specifically to rural areas, or if rural areas is a question, and the capacity to operate one single vending machine in rural communities, no, we would not have the capacity to do that. In fact, these businesses or these buildings that have the businesses in them would have to be deemed a viable business. So we would do a survey first and foremost to make sure that that business is in fact viable for a blind licensee to operate that business. If it is in fact not, we could potentially provide a waiver. We do that in rural communities where it is, if they have 2 or 3 or 4 vending machines, that certainly is not a viable business. So we would waive that specific location for the blind licensee, and then that public entity would then be able to go out on their own and provide the services that they need.
Thank you. And I was just wondering about the turnaround time for the applications now. I mean, when somebody wants to put a vending machine in a public building, and this doesn't even have to be from what I'm reading it, if a building accepts or any entity accepts public funds, even if it's not technically a public building, you would have first right of refusal if somebody wanted to put a vending machine in?
Thank you again for your question, Assemblywoman. This is Chris Mazza for the record. If a public entity is in a private building, if I'm understanding your question correctly, if the building is in fact not a public building, then no, we would not have the ability to put a vending machine in there. If a public entity were to lease or rent space from a private building and wanted a vending machine in their specific area, then yes, we would be able to put a vending machine in that specific area. As far as turnaround times, again, depending on the viability of the location, we work with not only blind licensees, but third-party contractors that could turn around these facilities in a matter of days, if not weeks, depending on where the location in Nevada would be.
Final question, Madam Chair, sorry.
Go ahead.
Is this Department of Blind, are they the only ones that have this, there's no other special needs, there's no other disability entities or peoples that would have a business like this as a blind? Is this the only thing that the blind business entity, the only one that gets a leg up like this in a business opportunity in our state, or are there other opportunities?
Thank you, Assemblywoman, for your question. This is Chris Mazza for the record. This is specific to people who are blind and visually impaired. It was established by the Randolph-Shepard Act, which is a federal act started in 1936. So yes, it's only, this act specifically refers to people who are blind and visually impaired, no other disability benefits.
Thank you. Do you have any other follow-up questions, Assemblywoman Titus?
Oh, thank you, Madam Chair. I appreciate all the questions I had. Thank you.
Okay, wonderful. Do we have any other questions from committee members? I didn't receive any on the Skype, but I'm looking around to see if there are any other questions. Oh, I have Assemblywoman Summers Armstrong. Go ahead with your question.
Thank you, Madam Chair, and thank you, Mr. Mazza, for your presentation. Do you have any information about the diversity in your licensees? You said there are 400. You said you had 400 locations, vending machine locations throughout the state. Can you clarify, is that 400, that does not mean 400 different vendors, but just vendors that have locations, there are 400 of them?
Thank you very much for your question. This is Chris Mazza for the record. Our program oversees 400 vending machines throughout the state. It does, you're correct. It does not mean that we have 400 individual licensees running those 400 vending machines. In fact, the program right now has 10 licensed operators, 2 interim operators, which means that they're on the path to obtaining their license, and 2 trainees with the potential for more trainees down the road. So currently we have 14 blind individuals in the program with the capability of running a business.
Madam Chair, may I follow up?
Go ahead.
Do you by chance have information on the diversity of your program? Both ethnic and do you have women, men? Can you give any information on the diversity in your program?
And thank you very much for your question, Assemblywoman. In terms of, this is Chris Mazza again for the record. As far as the ethnic background of our licensees, I would have to get back to you on that. I do not have that information. However, I can tell you, give me 1 second. We have we currently have 6 males and 4 females that are licensed operators. And I can tell you, I don't know the specifics on, like I said, their ethnic backgrounds, but they do vary quite a bit.
Go ahead and follow up.
Thank you. This program is not just vending machines, isn't that correct? Don't you also have hot food and other things? So of the, is it 24 or 14? I see you have 10 licensed, 10 interim, and 2 trainees. That's 20, or is that, and do I have that wrong?
This is Chris Mazza for the record, Assemblywoman. We have 10 licensees, 2 interim operators, and 2 trainees, so 14 people total.
Okay, so that includes both vending machines and food service.
That is correct.
Thank you.
And Mr. Mazza, for the record.
If you could please provide some additional information on the diversity of your pool, that would be great.
Absolutely. Thank you.
Thank you. Rochelle Wynn, if you can provide that to our committee staff, they will be able to distribute it to all the members for their review. I just have there were so many numbers being thrown around, so I'm just going to kind of do some own clarifying questions, if I may. You had initially said there were 400, is that 400 facilities, vending machines? Is that correct?
Thank you for your question, Chair. We have, this is Chris Mazza for the record, we have 400 vending machines, individual vending machines associated with the program, probably a little bit more than that, but those are individual vending machines.
And of those 400 vending machines, are those 400 separate individuals, or are those under those 14 that you had mentioned before?
Thank you for your question. This is Chris Mazza for the record. These are under, they're not 400 individual businesses, but a vending route, for example, may have in excess of 100 machines, 50 machines, depending on the number of machines that would make a site viable. So that we do not have 400 people, but 14 people are running the businesses of those 400 vending machines.
I'm sorry, is there any limitation on how many vending machines or licensees may have under the one business license? Does that make sense?
Thank you for your question. This is Chris Mazza for the record. Yes, it does make sense, and no, there is no limit.
I think we have another question from Assemblywoman Peters.
Thank you, Madam Chair. And my question is related to a statement you made in the description of the bill related to what I think my notes say is exemptions from the BEN program of live performance venues. Can you just discuss a little bit about the need for that? It was a kind of a vague description, and I'd just like a little more information around the purpose.
Yes, thank you for your question, Assemblywoman. This is Chris Mazza for the record. In our initial proposal of this bill, we had several discussions with the City of Henderson. The City of Henderson has entered into some entertainment facilities, if you will, Lifeguard Arena that is going to be the practice facility for the Henderson Silver Knights, because it does present a live entertainment venue. We felt it proper to include that in the exemption.
I'm sorry, I missed, I think, a little bit of the rationale. So it was the City of Henderson specifically, but it would impact every live public venue in the state, right? So like in Reno, I think we have a couple of event centers in Reno, so they would no longer be obligated under BEN to be surveyed for, okay, but give me a little bit more on the why.
Sure. Thank you for your question, Assemblywoman. This is Chris Mazza for the record. Those facilities in particular are a challenge for blind operators to operate based on the sales volume and the inconsistency, if you will, of, it could be busy a few days here and a few days there without having, if that is the sole business, to just do that occasionally, it tends to not be a viable site.
Okay, so it makes more sense to have it open to caterers or special event venue folks rather than having it exclusively go through your BEN process for assessment every time they have a live event. Okay, that makes sense. Thank you.
Yes, thank you.
And I'm looking around. Do we have any other questions from committee members? Assemblyman Haven, go ahead.
Thank you, Madam Chair. And I may have two questions, if that's all right. I believe we've stated that there was about 14 of these vendors. Of these 14 vendors, how many of them are currently blind?
Thank you, Assemblyman, for your question. This is Chris Mazza for the record. They're all blind.
All right, thank you.
You're welcome.
Did you have another question? You said you had a couple. Do we have any other questions from committee members? I'm looking to my left, looking to my right. Okay, it looks like the Chris's. I'm going to begin testimony in support, opposition, and, support, opposition, and neutral of Senate Bill 61. I'm looking around the room first. Is there anyone in the room that would like to present testimony in support of Senate Bill 61? Seeing no one running up to the table, I will next go to Broadcast Services. If we can go to the lines to seek testimony in support of Senate Bill 61, I'd remind callers to please clearly state and spell your name and limit your testimony to 2 minutes. And we can begin Broadcast Services when you're ready.
To testify in support of Senate Bill 61, please press *9 now to take your place in the queue. Chair, there are no callers in support at this time.
Okay, we will begin testimony in opposition to Senate Bill 61, and I will look around the room first to see if there's anyone that would like to provide testimony in opposition of Senate Bill 61. If you would like to do so, I'd ask you to take your seat at the table. Seeing no one running over to the table right now, Broadcast Services, is there anyone on the line in opposition to Senate Bill 61?
To testify in opposition to Senate Bill 61, please press *9 now to take your place in the queue. Caller with the last 3 digits, 938, please slowly state and spell your name for the record. You have 2 minutes and may begin.
I apologize, Madam Chair. I am here to actually testify in support, and I think I missed it.
That's okay. Why don't you go ahead and, Madam Secretary, if we can reclassify this testimony. I know that sometimes we're not quick enough on the the button. So go ahead with your testimony. I'd remind you to clearly state your name and limit your testimony to 2 minutes. Go ahead.
Thank you so much. Good afternoon, Madam Chair and members of the Assembly Health and Human Services Committee. For the record, my name is Ariel Edwards, ARIELLE EDWARDS with the City of North Las Vegas. We are in support of this measure and would like to thank Dieter for working with the cities and counties on the amendment language. Thank you so much for your time and consideration.
Thank you. If we can go to our next caller, I guess I will close support again and go back to opposition. If there are any callers in opposition to Senate Bill 61.
Caller with the last 3 digits, 120, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Madam Chair and members of the committee. Stephen Cohen for the record. Stephen with a V, Cohen as in the Assemblywoman. While this is an issue of great personal importance to me as the nephew of an aunt with a lifelong visual disability, albeit who lives in a different state, in light of the impacts of the pandemic, until we see public facilities return to sustainable capacity levels where folks would be able to serve customers. I just can't get there at this time. But like I said, completely support the concept in future sessions. With that, Madam Chair, thank you, and I yield.
Thank you, Mr. Cohen. If we can go to our next caller in opposition.
If you have recently joined the call and would like to testify in opposition to Senate Bill 61, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you, Broadcast Service. If we can look around, I will open up testimony in neutral to Senate Bill 61. You can make your way to the table. Please clearly state your name for the record and begin when you're ready.
Thank you, Chair. It's good to see all of you in person. Michael Hillerby, representing the City of Sparks. We'd like to thank Dieter and the folks at the agency who testified today and make the presentation for working with us on some concerns about local buildings. We wanted to be sure that our elected officials in our communities had an appropriate level of involvement in those decisions. They worked very well with us, and that language is included in sections 7 and 11, and also in the written testimony the agency provided with some background. But again, we want to thank them for working closely with us and arriving at a good version of the bill. Thank you.
Thank you for your testimony in neutral. Do we have any other people to testify in neutral here in the room? Seeing none, Broadcast Services, if we can go to the phone line to begin testimony in neutral.
To testify in neutral to Senate Bill 61, please press *9 now to take your place in the queue. Caller with the last 3 digits, 948. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Nguyen and members of the committee. For the record, David Cherry, spelled Davidcherry, and I'm Government Affairs Manager with the City of Henderson. I want to begin by thanking Administrator Hendren and her very capable team for working with us to address the city's concerns with SB 61 as introduced. The reprint being considered today contains substantial changes that resulted from these discussions with local government and has allowed us to move to a neutral position. The city already offers blind entrepreneurs who are part of the BEN program business opportunities at multiple city facilities, and we recognize the benefits of this program for those it serves. Importantly, the reprint restores the consent-based framework now in current statute when it comes to determining if vending services are needed and if so, what type. Finally, the city appreciates the reprint Section 6 language that grants an exception from NRS 426 requirements when a lease is granted to an operator for live entertainment purposes, which reflects an increasingly common practice for many covered entities. Again, thank you for the opportunity to present this testimony.
Thank you. Broadcast Services, do we have anyone else in neutral?
With the caller with the last 3 digits, 978, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, good afternoon, Madam Chair. Joanna Jacob, Joanna Jacob, Government Affairs Manager for Clark County. Madam Chair, members of the committee, we worked with Dieter on this bill in the Senate on behalf of all of Clark County's departments, and specifically on behalf of the Clark County Department of Aviation that operates McCarran Airport. Dieter worked with us to address all of our concerns, and we were opposed in the Senate side, but we are neutral with the amendments and with the testimony today. I want to thank Administrator Hendren, though she is not here today, but on the record, and her team for working with us. And we are hoping Clark County has extended our partnership with the Dieter Ben program, and we are hoping to find additional ways to partner with them where appropriate and where it's feasible. And we are neutral on the measure as proposed today. Thank you.
Thank you, Ms. Jacobs. If we can go to our next caller in neutral.
Caller with the last 3 digits, 232. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Chair and members of the committee. For the record, my name is David Daslich, D-A-Z-L-I-C-H, Director of Government Affairs with the Vegas Chamber. I would just like to echo the sentiments from my colleagues with the cities. I'd like to thank Administrator Hendren for working to address our concerns, and would like to note that we have moved to neutral from our original opposition thanks to the amendments made to SB 61. Thank you.
And Chair, there are no more callers on the line in neutral at this time.
Thank you, Broadcast Services. At this time, I will turn this back over to the Chris's, if you'd like to make any closing remarks on Senate Bill 61.
Madam Chair, Christopher Sewell for the record. We would just like to, thank you and the committee for giving us this opportunity to present this very good bill for the blind enterprise businesses throughout our state. And we do look forward to its passage and signature by the governor. And I also want to sort of do a little quick shout out for Mr. Mazza. He was put in a position earlier a few days ago, and this was the first time he's ever testified before the legislature, and I think he did a great job. So Chris, thank you, and I'd like to also just again thank the committee and all of the folks supporting the committee for their assistance. Thank you, Madam Chair.
Thank you. You guys did fantastic. I know that everything is moving very quickly, so I appreciate you stepping up and to present this bill. And so with that, I will close the bill hearing on Senate Bill 61. And if we can just take a 1-minute recess, because I'm going to see who we are up next with. I see Senator Harris here, so just a 1-minute recess. Thank you, and I will call us back to order. Broadcast services, are we ready? Yes, no, maybe so.
Yes, Chair.
Thank you. And with that, I will now open the bill hearing on Senate Bill 275. This does revise provisions relating to communicable diseases. I would note, I did put this in the chat, there was a new proposed amendment that was just uploaded to Nellis. It probably was also emailed to the committee members. I've been told by Senator Harris it is a friendly amendment from Argentum Partners. So I believe the presentation today will be based on that friendly amendment that has been uploaded. And with that, welcome to Assembly Health and Human Services again, Senator Harris, and please begin when you're ready.
All right. Hey, good afternoon, committee members. Chair Nguyen, thank you all so much for taking the time to hear Senate Bill 275. My name is Dallas Harris, and I represent Senate District 11. It's my honor to present to you Senate Bill 275. With me today, we have the esteemed former Senator David Parks, Andre Wade, Executive Director of Silver State Equality, and Brad Sears from the Williams Institute at the UCLA School of Law. As the chair noted, we also have a member from Argentum Partners. Actually, I believe we have Jen Howell available, I apologize, from the Washoe County Health District to answer questions about the amendment from Argentum Partners. That is an amendment submitted by the health districts. Senate Bill 275 will modernize Nevada's laws on human immunodeficiency virus, or HIV, by treating HIV in the same way as Nevada treats all other communicable diseases. In doing so, Senate Bill 275 will remove from Nevada statute discriminatory laws that unfairly target people because of their HIV status. These laws were not rooted in science, but in fear, and have had significant negative public health consequences for Nevada for decades. Senate Bill 275 is the culmination of many years of thoughtful discussion and hard work led by Senator David Parks. I've asked him to join me to provide you a historical review of how we got to this important hearing today. And Madam Chair, if it's okay with you, I'll turn it over to Senator Parks.
Go ahead and welcome Senator Parks.
Thank you, Chair Nguyen, and members of the Health and Human Services Committee. Good afternoon. For the record, I'm David Parks. During the 80th session of the legislature, I was successful in getting passed Senate Bill 284, which created a task force to examine and make recommendations for the revision of existing statutes related to the criminalization of HIV and AIDS. These outdated statutes taken under review grew out of the recommendations from an advisory task force created by former Governor Richard Bryan some 35 years ago in 1986. Over the 30 years that the task force was in place, I was a member of that task force. During the early years of the HIV infection and the AIDS epidemic, states including Nevada implemented HIV-specific criminal exposure laws. These laws imposed criminal penalties on people living with HIV who knew their HIV status and who potentially exposed others to HIV. In 1990, the Ryan White Comprehensive AIDS Resources Emergency Act provided states with funding for HIV and AIDS treatment and care, and required every state receiving federal funds to certify that its criminal laws were adequate to prosecute any HIV-infected individual who knowingly exposed another person to HIV. In our legal system, criminalization of potential HIV exposure is largely a matter of state law and not federal legislation. An analysis by the Centers for Disease Control and Prevention and the U.S. Department of Justice found that at least 67 laws had been enacted in 33 states, explicitly focused on persons living with HIV. The majority of these laws were passed before antiretroviral therapies were developed that reduced the HIV transmission risk to zero. Currently, it is possible to be HIV positive and have no detectable presence of the virus. As a person who helped develop Nevada's HIV/AIDS statutes and regulations in the late 1980s and early 1990s, this is an issue that I have personally wrestled with for the last 4 legislative sessions. Over the years, we found that criminalization laws do not support evidence-based public health practices of reaching those that are at higher risk for HIV and AIDS. Data indicated people that are at high risk for HIV exposure are deterred from testing, which facilitates HIV care and prevention methods that will stop the transmission of HIV. Fear of being charged with life-altering felony charges and prosecuted for living with HIV and not disclosing their status deters both testing and seeking out care. With the passage of SB 284 last session, a coalition of social service and healthcare professionals from across the state and nation worked diligently to address this issue and develop recommendations for consideration by the legislature in Senate Bill 275. Before I conclude my testimony, I want to shout out a giant thank you to all those individuals and organizations who came forward to work on the SB 284 task force and the development of Senate Bill 275. The work that was accomplished was beyond my wildest expectations. I also want to thank Senator Harris for her introduction of Senate Bill 275. Madam Chair, it's long past time for Nevada to modernize its HIV laws. This concludes my prepared remarks. Thank you for your consideration of Senate Bill 275 and the privilege of your time today.
Thank you so much, Senator Parks. Madam Chair, members of the committee, Nevada's current laws regarding HIV are outdated, ineffective, and frankly discriminatory. Currently in Nevada, it's a Class B felony for a person living with HIV who knows their status to intentionally engage in behavior that could transmit the virus to someone else, regardless of transmission risk or intent to transmit the virus. Further, in 1993, 28 years ago now, the Nevada Legislature passed Senate Bill 514, which prohibits certain conduct through which HIV can be transmitted after testing positive for the disease. The consequence for those found criminally liable can be a prison sentence of up to 20 years and or a fine up to $10,000. In Nevada, individuals can be convicted of HIV transmission even when there is no intent to transmit HIV and no risk of transmitting HIV. Our laws have not kept up with science. In this modern world, we know how to eliminate the risk of transmission through treatment of individuals living with HIV. Our laws criminalize behavior that cannot transmit the virus. Further, our laws are ineffective and counterproductive to our goals associated with ensuring Nevada's public health and welfare. No other disease is included in Nevada's criminal code. That's because criminalizing sickness forces sick people into the shadows and discourages sick Nevadans from getting tested for the disease for fear of punishment. Not only do our laws fail to prevent the spread of HIV, they are an obstacle to ending the HIV epidemic. So I quickly want to walk through what the bill does. Senate Bill 275 makes intentional conduct that may transmit HIV a misdemeanor instead of a felony, and moves the statute from the penal code to the public health code. In doing so, this would align with the state's treatment of HIV with that of other communicable diseases. Senate Bill 275 also amends outdated laws that criminalize behaviors such as biting and spitting. Modern science has taught us that you cannot transmit HIV through saliva, yet Nevada law subjects someone with HIV to extra punishment for such behaviors simply because they have HIV. Let me be clear, such behavior is assault and battery and should be treated as such. That will not change under Senate Bill 275. Senate Bill 275 also repeals the Nevada law that makes it a felony for people living with HIV to engage in sex work. This does not change Nevada law that makes illegal sex work a misdemeanor under Nevada law. If we've learned anything from the past year, it is that we know testing, transparency, and treatment are essential to address a public health crisis. Individuals living with HIV should not live in fear of criminal penalties simply because they've contracted HIV. Senate Bill 275, by modernizing Nevada's HIV laws, will enable us, the Nevadan family, to proactively tackle and hopefully bring to an end the HIV public health crisis in Nevada. And Madam Chair, with your permission, I'd like to turn it over to Mr. Andre Wade for just a couple of comments.
Go ahead, Mr. Wade.
Thank you, Senator Harris. Hello, Madam Chair Nguyen and Vice Madam Chair Peters and members of the committee. As stated, my name is Andre Wade, and I'm State Director for Silver State Equality, a Nevada-based statewide LGBTQ civil rights organization, which brings the voices of LGBTQ plus people and our allies to the institutions of power in Nevada and across the United States, striving to create a world that is healthy, just, and fully equal for all LGBTQ plus people. Also, I am chair of the Governor's Task Force on HIV Modernization, which was tasked with reporting out findings and making recommendations, which you should have received. Today, I'm speaking to you on behalf of Silver State Equality. This bill has been many years in the making, as you heard from Senator Parks, because for decades now, there have been outdated, ineffective, and discriminatory laws in Nevada that do more harm than any good that could come of them. Just to note that there are about 9 other states working on HIV modernization this year across the nation. While efforts are underway to end the HIV epidemic by, in part, developing statewide and local plans to address people getting tested and to know their status, getting people in care and to stay in care, these plans also include modernizing our laws that criminalize otherwise legal behavior or increase penalties for criminal behaviors based on a person's HIV status. These laws stigmatize people living with HIV and go against the very public health efforts to end the HIV epidemic that has been put in place by specifically calling out HIV in the law when other communicable diseases are not. And of course, these laws disproportionately affect the Black community, as you'll hear more about Nevada specific research findings in just a bit from Brad Sears with the Williams Institute. So moreover, the issue at hand is to simply treat HIV like any other communicable disease and not require sentence enhancements. This effort is supported by the U.S. Center for Disease Control, the National Institute of Health, the American Medical Association, and the U.S. Office of Infectious Disease and HIV/AIDS Policy. We have submitted sign-on letters that include about 40 individuals, including those who are Spanish language speakers, and 27 organizations across Nevada. HIV is a public health issue, not a criminal one, and our law should reflect that. Thank you in advance for your support for this very important piece of legislation. This ends my prepared remarks. Thank you.
And Chair, just one more presenter, if I may, Mr. Sears, who can speak a little bit about some of the Nevada-specific studies that he's conducted.
Perfect. Go ahead.
Thank you, everyone. My name is Brad Sears, B-R-A-D-S-E-A-R-S, and I'm the Associate Dean of Public Interest Law at UCLA School of Law. And it was my pleasure to be able to do a study at the Williams Institute at UCLA, similar to other studies, to really measure the impact that Nevada's HIV criminal laws have had on people. I'm going to be very quick, but I am going to share my screen right now. So you can see some of the results. And I want to start by a big thank you to Nevada's Department of Public Safety's Records, Communications, and Compliance Division. They responded to our records request not only once, but multiple times, and were just extremely cooperative in helping us not only providing the data, but really understand it. I just want to highlight a few things that we learned and start by saying that these themes are consistent with the 4 other states for which we've done similar analyses. And the first finding is you might think that these laws were passed a long time ago and enforced a long time ago, and then now they're enforced less. That turns out not to be the case. So this isn't a solution in search of a problem. People are still being arrested and charged with these laws. About 63% of the arrests in the data have happened since 2013. And you can see 3 of the 5 biggest years for arrests since these laws were first passed have happened since 2013. It's an ongoing issue impacting Nevadans. Secondly, and again, consistent with the other 4 states that we've looked at, while the initial focus of this law might have been on other types of conduct, they're really used now primarily to charge people who are also charged with sex work. Unlike sex work, they carry felonies instead of misdemeanors, and as Senator Harris said, much higher sentences. And so they increase the penalty for people suspected of doing sex work. And so you can see 61% of the charges are against sex workers. That also means, I think, unlike probably what was in people's minds in the 1980s and 1990s, these crimes are not being charged just against men, but women. And you can see that about a third of the charges are against women. That corresponds with the focus of the charges against sex workers. That's double of the percentage of the HIV positive population in Nevada who are women. There's one other kind of demographic statistic we want that for me really opens up the picture of who these laws are impacting. The age range of these folks is from 17 to 68. So when you take that age range and you think about sex workers, you also have to think about a number of young girls, women who may be trafficked. If you're in your 60s and doing sex work, like it may be for survival reasons, that these are felonies and huge penalties impacting already vulnerable populations that we want to engage with public health. The other thing that has been absolutely consistent across every state we've looked at is that these laws disproportionately impact people of color and particularly Black people. And so a way to sum up this chart is if you have a disease like HIV, which we know disproportionately impacts Black people, and you have a criminal justice system that disproportionately impacts Black people, and you make a crime out of that disease, this is the only thing that's going to result. While Black people make up 10% of the state's population, roughly, they're about 46% of convictions for HIV crimes. Something else we've seen similar in the other states that we've looked at is that enforcement is not universal across the state. It's really concentrated in a handful of places. In Nevada, this comes down to 3 counties, with almost 80% of the arrests not only being in Clark County or Las Vegas, but by the Las Vegas Metro Police. So it is, in a way, a statewide law that impacts all people with HIV and prevention efforts that has a very localized enforcement. And the final thing to point out is, and I think this echoes Senator Harris, is when you think about what's being charged, are these people intending to transmit the virus? Have they actually transmitted the virus? And have they even engaged in conduct that transmit the virus? Well, these laws, and so none of these folks were charged with the intent to transmit the virus. None of these arrests or convictions actually involve transmission of the virus. And I think probably most surprisingly, most of the arrests are for conduct that doesn't have anything to do with transmitting the virus. Most sex workers are arrested or charged for conduct that they do on the street communications that happen online or by actually stealing operations of law enforcement. So that really that doesn't really cover conduct that can be transmitted by HIV. I think the surprising new thing about Nevada that I've not seen in the other 4 states we looked at is that 1/3 of all convictions are for attempt or conspiracy charges. So when you think about attempt to solicit or conspiracy to solicit, you're really, so the conduct that usually is charged for solicitation hasn't even happened, right? It's an attempt to do that. This makes more sense when you consider that 95% plus people in the criminal justice system plead. But again, we're getting more and more removed from conduct that can actually transmit the virus. So thank you for allowing me and the Williams Institute to do this project, and I'll be available for questions later.
Thank you so much, Mr. Sears. I believe that concludes our presentation, Chair, and I am more than happy to answer any questions. And as I mentioned, again, we have Jen Howell here from Washoe County who can answer questions on the amendment. What you see before you is the result of a lot of work and collaboration to make sure that we are trying to put our laws in a better, less discriminatory place, while also ensuring that our health districts have the authority they need to clamp down on any infections that are spreading and to keep the community safe. It's been a long road, but hopefully with this last amendment, we are there. Thank you so much.
Thank you. I will start a couple of questions. I know we have some questions from our members. You had indicated that we don't criminalize any other kind of health condition that someone might have. So we don't have any kind of corresponding laws for, like, say, hepatitis. Is that correct?
Thank you for the question, Chair Nguyen. That is correct. Yes, we do not have a law that makes the intentional transmission of hepatitis a felony.
And we don't have the same thing for HPV or syphilis or any other sexually transmitted disease. Is that correct?
Thank you for your question again, Chair Nguyen. Yes, that is correct.
Okay. And I can tell you that when I first started practicing law, we would see these cases a lot, especially in the area of prostitution. And at the time, there was like a mechanism that law enforcement, I believe, would be able to look at like the health records, and they were like essentially a part of like your criminal background check in determining how. Would this law remove those kind of like reporting to other agencies of personal medical records? Would it eliminate that?
Thank you for the question, Chair Nguyen. I am not aware of us tinkering in that section at all. So as far as I'm aware, no, it would not change any information sharing that's currently happening.
Do you know if any of your other presenters know how that information is provided? Like, I know that in previous cases that I had, it was a situation where I would get like a health record showing that someone had a positive test for HIV or AIDS, and then that would be used to enhance the criminal penalty for a like prostitution charge. Do any of your other committee members know that?
Oh, I don't know if
not committee members, I meant presenters.
I don't know if Ms. Howell is aware of what the kind of sharing agreements are currently with law enforcement, but if she could speak to that, that'd be great.
Good afternoon, everyone. Jennifer Howell, Sexual Health Program Coordinator at Washoe County Health District, for the record. The way that we've done this in Washoe County is that if we provided testing in conjunction with law enforcement during, say, a prostitution sting, then we would provide that the test results. If we did not test with them during the same event, then we would not provide that information, and they would have to seek that information through a court order. So that's the only time that the information was readily available to law enforcement, and we don't provide the information otherwise. So it's my understanding that getting rid of the enhanced charge for the prostitution related section of this would then eliminate that information sharing.
Thank you. And one last question. As far, you had mentioned that it would reduce some of these charges that are currently felonies because of this status, this health status, down to misdemeanors. Is that just consistent with every other person that would commit the same crime?
Thank you for the question, Chair Nguyen. Yes, we are literally removing the felony and without explicitly calling out HIV, because that defeats the purpose, placing it with other communicable diseases. I believe science has shown there is no reason to single it out.
Thank you. And next we'll go to Assemblywoman Thomas.
Thank you, Chair Nguyen, and thank you, Senator Harris, for bringing this bill forward and for some of the explanations that you have. My, I guess, question, AKA comment, also would be to this, HIV is unlike any other communicable disease, yes or no?
Thank you for the question, Assemblywoman Thomas, to you through Chair Nguyen. I would say it's like other communicable diseases, and in so much as it's like other communicable diseases, of course they vary in treatment, in cause, in transmission rates, but it doesn't vary any more than any other communicable disease would.
Thank you. So, Chair Nguyen, follow up, please.
Go ahead. And Senator Harris, feel free to go directly to the question.
Thank you. And Senator Harris, with that said, and I understand making it a misdemeanor by law, but my concern are those individuals that know that they're positive, whether they're in the sex trade or not, can use their status as a weapon to other people because they got it, so therefore everybody they come in contact, they want to issue that. Is that still a misdemeanor?
Thank you for the question, Assemblywoman Thomas. I'd first like to note, I think your uneasiness is a little bit about, kind of explains why we've got to bring this bill, right? There are people who are living with all kinds of communicable diseases who could, for some reason or another, choose to go out and attempt to weaponize that. HIV is not the only communicable disease that someone could, let's say, intentionally transmit. Perfect example is coronavirus in today's example, right? But the fear and the stigma that's been put behind HIV over the last 30 years is, I think, what's leading to that uneasiness. I would argue that if someone goes out and, in the worst case example, I guess, would have to draw their blood, maybe, and then stick someone in their sleep without them knowing it or walking by them, there is a slew of charges you could charge someone who engages in that type of conduct for. And you'd be able to do that for some other type of communicable disease if there's someone out there who is intentionally trying to harm other people. There's no reason that we have to call HIV out separately.
Thank you.
Next, we have Assemblywoman Titus.
Thank you, Madam Chair. Senator Parks, it's great to see you. Thank you for continuing to be an advocate. And Senator Harris, thank you for bringing the bill. I was absolutely supportive as we made changes in the last sessions regarding the need to decriminalize HIV, and I think it's critical that we do so. My concern is not the HIV components of this bill. My concern is it almost looks like now we're criminalizing all communicable diseases and not spelling out HIV. Senator Harris, you mentioned the coronavirus because that's a communicable disease. And so as a board chair of our county health board, I'm the chair of our board, and as a county health officer, we struggled with the coronavirus epidemic. And how do we handle folks that we know have coronavirus, they wanted to attend an event, say, and we know that they had just tested positive, and could they or could they not go? And where were we legally, what could we do with that? And having struggled with that, we certainly understand that the mandate to quarantine, My concern with the bill, especially in the amendment first reprint that, thank you for sending ahead of time, actually, so we could get a copy of it. Section 1 on the bill amended recommendation is treat any person or group of persons with communicable disease and those exposed to communicable disease. What if a person, I understand the quarantine aspect of it from a public health point, my concern is the treat the person. What if the person doesn't want to be treated, wants a course to run its natural course? Is there, where is it, and what's the individual rights to personal choice when it comes to treatment?
Thank you so much for the question, Assemblywoman Titus. I'll take a first stab at it, and then if I can, kick it over to Ms. Howell, who does this in her daily practice. Let me just start off with the language, the word treat. We changed the word treat from what was previously disinfect, which is a little bit antiquated, right? So the existing law was to say you can disinfect someone. We decided treat was a much more appropriate term. I'll also note up top, this is about what the County Board of Health may do. There is no shall there, and I'm looking at Section 1, County Board of Health may, and then everything that follows beneath it. Thirdly, I'll mention, if you know previously in existing law, it says isolate, quarantine, and disinfect. Those are all under one line. We actually had a discussion today in order to protect personal liberties that you need to isolate someone in certain circumstances, you may need to quarantine someone in certain circumstances, and then you need the ability to treat people in certain circumstances so that we don't have folks who really just need to be treated under the same qualifications as someone who might need to be quarantined. And so I'll, if I can, I'll kick it over to Ms. Howell to talk a little bit about what happens when you want to treat someone and they tell you to pound sand.
Good afternoon, Jennifer Howell again for the record. To you, Assemblywoman Titus. It's definitely a, as far as we've interpreted it, it's a individual right. So if someone does not want to, say, engage in STD treatment, HIV treatment, any of the communicable diseases, that is their right, but they still may be subjected to quarantine or isolation based on that information, as long as they are in an incubation period or an infectious period.
I thank you for that. I think I just needed clarity that a person still had that right to, as a provider, and I would counsel a patient, they had the right to refuse treatment, providing that, then you have to look at the public health aspect of that. And I agree, these are questions that need some clarity, and I appreciate the option in here to have a judicial review and a pathway if you disagree. And just an observation, in my day, we used to have parties when we knew there was a communicable disease. If we had chicken pox, it was everybody went to that house because all kids needed to be exposed to that. And those days have certainly changed. So again, thank you for bringing the bill forward. And Senator Parks, great to see you. Thank you, sir. And thank you, Senator Harris.
Next, if we can go to Assemblywoman Summers Armstrong.
Thank you, Madam Chair, and thank you, Senator Harris, for the presentation. I think I'd like to just sort of ask a clarifying question leading behind what Assemblywoman Titus asked, and that is, if a person, in the case, let's be specific about HIV, chose not to seek treatment, but still carried on in their behavior. And you said there are other things that can be brought for that person. Can you please expound upon that?
Thank you for the question, Assemblywoman Summers Armstrong. I'll start and then I'll allow Ms. Howell, if she can, to supplement. Yes, so what happens is if you are infectious or you've got a communicable disease, you're posing a threat to public health, you're going to get a warning from your public health district. They're going to let you know, hey, by the way, this behavior is dangerous, please don't do it. The second time you do that, you ignore that warning, that's where the misdemeanor comes in. That's what's in existing law for 441A, I believe it's 180, okay? That is the current state of the law for every disease except for HIV. So now we're bringing HIV under that process. And I'll turn it over to Ms. Howell to talk a little bit about what happens after you have a misdemeanor and you are still continuing to engage in that behavior. It's my understanding they bring in public health, the police, to help them enforce these types of things. But Ms. Howell, if you could.
Thank you, Jennifer Howell, for the record. So what happens is the DA, our civil DA, brings those charges forward, and then we work with law enforcement. I've not been aware of this happening in my 20 years of working at the health district, but that's what the mechanism would be as it's been explained to me. Now, to the question, if someone decides not to engage in their HIV treatment, then that is their choice. And we've had people in the community that I've encountered that have done that for various reasons, and it's their right to do so. But we just want to give them all the explanations as to why it would be beneficial to their health and to the health of other people. And then if they were to go into intentional transmission, then it goes into a warning and what Senator Harris was describing.
And if I may just follow up very quickly, it was very important that we maintain the health district's ability to keep the public safe, right? And so any rogue actors out there will continue to be treated as such.
Thank you. I hope I didn't just lose my train of thought. So we know that we, especially in Southern Nevada, we are having outbreaks all the time of syphilis, gonorrhea, all other kinds of communicable diseases. Is there any difference? First of all, we're talking specifically, Mr. Wade spoke about and the gentleman from UCLA spoke about how this particular law affects Black people more than anyone else. Are any of these other diseases, is there help available? Because we're still seeing high rates of HIV in Black communities. So we get rid of this charge. If people come to the health district and they need help, do we have resources available to treat them if they want to be treated? Because we see, even with COVID, the lack of access to health care is a real issue. So can you speak to that so that we can all have clarity, and also speak to, if you can, the rate of transmission? And are we seeing any of these other diseases, syphilis, gonorrhea, HPV, anything? What are they looking like in other communities, Black communities and other communities of color? And is there help available? We don't want to just say, okay, we get rid of it and then we don't help people. We need to make sure that there's sufficient help. Thank you.
Thank you for the question. I'll use this as a chance to plug another one of my bills, Senate Bill 211, which is a bill that would require providers to offer HIV and traditional STI testing in hopes of addressing which you hit on is really some, frankly, embarrassing STD numbers here in the state. And I think that in conjunction with this, will do a lot to try and bring that down. But I'll turn it over again to Ms. Howell to talk a little bit about the treatment, what happens when someone comes in and says, hey, I need help.
Thank you for the question, Jennifer Howell, for the record. So if it's an index case, which means someone that we just found to be that has an STD or HIV, including HIV, that's reported to us by a physician or a provider or by our own testing, then we make contact with that person to either see if they've had appropriate treatment, because some providers do not follow appropriate STD treatment guidelines, or if they're connected to HIV care, or if they want to be. And then if needed, Washoe County Health District doesn't offer HIV care, provision of HIV care, but we do refer to our community providers, and there's a couple private providers that do provide that service. So we do warm handoffs and very active referrals. We don't just give them a phone number and tell them to go on their way. We actually make appointments, especially if it's someone living with HIV. We make those appointments with them in our offices as much as we can and make sure that we have a good connection to those care services. For STDs, it's a little bit different. Again, we will make sure that they have appropriate treatment through their provider or their provider offers that treatment. If they don't receive that treatment, then we will follow up with them to offer that treatment through our clinic. And I hope that answers your question. As for the disproportionate impact by race, it definitely is there. It's in Washoe County. It's in Southern Nevada as well. It's something that we do need to address by addressing a larger scale of health disparities and getting people access to services and having them feel comfortable with those services is a huge part of that. But we definitely don't turn away anyone, and we definitely follow through on all of those cases reported to us. We just need to know that the person has a positive test to be able to follow through with them, which is what Senate Bill 211 does. So we work as hard as we can, as diligently as we can, to ensure that there are no gaps in services if a person wants to seek those services. And we try to indulge any issues that come up with a client to do so.
Thank you. And if you can get any of that other information that Assemblywoman Summers Armstrong mentioned regarding like transmission rates for other communicable diseases, that would be wonderful if you can get that to our committee staff and we can distribute that. Next, I'm going to go to Assemblywoman Benitez Thompson. I know she had some clarifying question regarding a statement that Ms. Howell made.
Thank you so much. And it was the factoid you had there in reference to the use of the DA's power if they needed to, and that you hadn't seen that used in for 20 years. And I wasn't sure if that was in response specifically to the HIV statutes as we have them, or to all communicable diseases.
Yes, Jennifer Howell for the record. I'm more familiar with HIV. I've worked in that program for 20 years, but in terms of other STIs, I have not seen that either. But going out beyond those to the broad list of communicable diseases and that are listed in NAC 441A, I have not heard of it, but I can definitely see if we have done that and get that information back to you. But it's not something that I have been, that I've heard of that we've had to enforce that.
Thanks so much. I appreciate that. Just because I wondered more, it seems to be that where more of these conversations have played out, sometimes have been like with tuberculosis, and when you have someone who's active and positive, and sometimes it can be difficult to get their consent if they are someone who tends to be non-compliant or if they have behavioral health issues. So I was wondering, I was like, oh, I can't imagine that we've never had to use that for someone who has, but I'll let someone else with more data tell us more about that. And then I also just wanted to clarify, because we were having a conversation about treatment and right to treatment, but I believe 441A already kind of clearly states in there that the health board does not have the ability to interfere with the person's right to treatment. And I think it reads both ways, right to treatment or right not to have treatment. So I think we already have that covered in status quo, that there's nothing about statute that person already has that ability to accept care or not accept care. I just didn't hear the reference to, I think it's 441A 200 or something like that, just from past conversations. I think I've heard that referenced.
And I think we have Ms. O'Krent on the Zoom. She may be able to further clarify. So if I can have her kind of take a look at that, and feel free to pop back on when you have that answer. Do you have any other questions while we're waiting for that legal response, Assemblywoman Benitez Thompson? I'm going to take that as a no. Ms. O'Krent, did you have any comments on that as well? Oh, she might be gone as well. I've lost all of the staff. I will have her follow up with committee members if we can by the.
I'm sorry.
Oh, there she is.
Can you see me? I'm sorry. I look frazzled. Assemblywoman Benitez Thompson was correct in referencing 441A200. Can you hear me? Okay.
We can't hear you. Sorry to catch you off guard.
I'm sorry. No, you didn't catch me off guard. I just was having trouble with, like, the thing was minimized and I couldn't get it to pop back up. So I apologize. I was here, and absolutely 441A200 is correct.
Thank you, Ms. O'Krent. Do we have any other questions before I go to public comment? Or, oh, I do. Vice Chair Peters, go ahead.
Thank you, Chair. I think it's important in this conversation to get on the record the advancements that have been made around the treatment and reduction of risk related to contraction and prevention of HIV, because that kind of is what's changing the narrative around how people engage in the world after they have become positive with HIV. So could someone talk to the advancements in those antiviral drugs, including PrEP and PEP, and what those have meant to the potential risk for HIV contraction?
Thank you for bringing up that point, Assemblywoman Peters. I'll turn that over either to Mr. Wade or I think Mr. Sears might be able to answer that question as well in a bit more detail than I'd be able to.
Yeah, I'm happy to jump in and take a stab, and then Mr. Wade can fill in if necessary. So Brad Sears again from UCLA and the Williams Institute. And so definitely, when you think about the time that these laws were passed, we had no effective treatments for preventing or for treating HIV and for preventing HIV. We were just several years out from even having a test that could identify the virus. Since the mid-1990s, a few years after the last one of these laws was passed, we have had those effective medications. And so in the mid-1990s, you saw death and illness rates drop. You also saw transmission drop. What we know today, and what we've just learned in the last few years, is that if you're on those effective medications and you have an undetectable viral load, you cannot, and for someone like me who's been doing this for decades, that's hard to even kind of digest, but you cannot transmit the virus through sex. And we think, and there's other research that's growing, you also can't transmit it through other means. These laws take none of that into account. Just the fact that having HIV is no longer a death sentence. There are other illnesses out there that have, on average, more serious consequences, and that people's ability who are HIV positive to transmit is greatly reduced. Part of those effective medications is if you think you've been exposed, you can do post-exposure prophylaxis or post-exposure treatment, highly effective in preventing you even after that exposure of being HIV. Also proven to be very effective is pre-exposure prophylaxis. So we have a growing number of people who are at high risk who take the medications even though they're not HIV positive. So if they ever become exposed, they're no longer HIV positive. And I guess just to end by picking up on an earlier comment, you can't police your way out of a pandemic, right? We've shown that now with HIV. We're showing that with COVID. But getting people access to treatment and to pre-exposure and post-exposure medications is a way to really fight HIV.
Thank you. If I may have a quick follow-up, I would actually like Mr. Wade, if you wouldn't mind talking a little bit about the access to PEP and PrEP in Clark County.
Yes, Assemblywoman. Vice Chair Peters, we're happy to. This is Andre Wade for the record. So currently, there are PrEP navigation services in place. As an example, Southern Nevada Health District has it. I believe the LGBTQ Center of Southern Nevada and perhaps other organizations. And so they help individuals learn about and access PrEP medication with or without their insurance coverage. You have the Huntridge Health Clinic out here in Southern Nevada that provides PrEP and PEP medication for free for those who are unable to afford the medication or have trouble accessing it. There is a statewide effort to have PrEP become more available. So as another plug for a bill, SB 325 that's moving through the legislative session would allow pharmacists to prescribe PrEP and PEP to individuals without a prescription, as well as ancillary services related to the medication, which would greatly increase access to this medication, which would then greatly decrease the risk of transmission and really have us to begin to truly get it to where the rates of HIV infection are lower in Nevada, because right now we're in the state with the highest rate of new diagnoses and people living with HIV west of the Mississippi. And so we really need to combat this. So having on the ground community access to medications like PrEP and PEP, having pharmacists being able to prescribe it, and a lot of the other public education that's going on out there would help folks to even greatly have access. And I'll just close by saying we're still having to educate medical providers on this medication to better inform them. So access continues to increase. So thank you.
Thank you for the responses. I appreciate that. And I think that it's really amazing how far science has come in relation to this disease. And I do believe that all of the work and effort being done to ensure that people have access to these preventative medications and these treatments is really going to benefit the state, not just in access to, but destigmatizing the ask for a test and making sure that you're getting proactive treatment.
And Madam Chair, with your permission, I'd like to ask the Secretary to strike any references to shout-outs to Senator Settlemyre on the record.
I'm sure we will make sure that that was clearly in the records of the minutes. Your request, that is. At this point, I'm going to get to begin testimony in support of Senate Bill 275. I will start here in the room. Oh, look, it's a race. It's a race to the desk. So go ahead, and I would remind you to please clearly state and spell your name for the record, and please limit your testimony to 2 minutes.
Oh, hello, Madam Chair and Assembly Committee members. My name is Carlo Misiano, C-A-R-L-O, last name M-I-C-I-A-N-O for the record. I'm a registered nurse and speaking on behalf of the Southern Nevada Asian Pacific Islander Queer Society. I'm in support of SB 275, HIV modernization, because it focuses on decriminalization of individuals based on their HIV status. As it exists now, Nevada law is discriminatory and disproportionately affects communities of color, especially Black people, sex workers, and the LGBTQIA+ community. As a nurse, HIV is a public health issue, and it is very concerning to encounter patients that are newly diagnosed with HIV in the hospital setting because they fear seeking tests and treatment and continued care that goes beyond education of safe-sex practices. So when they're newly diagnosed in the hospital setting, but they could have been caught much, much sooner if they weren't afraid to even seek out resources. With this said, I would say that the passing of SB 275 would be a strong start in ending the HIV epidemic and destigmatizing HIV as an illness. It's to normalize talking about using condoms, to get on HIV medications, antiretrovirals, PEP, PrEP, and of course, monitoring one's HIV status without public scrutiny. The dialogue and the stigma around HIV needs to be changed in order to properly address the health crisis. So thank you for your time.
Thank you for your testimony. We will go to our next person in support here in the room, and I am going to be turning over chairing duties here to my very, very capable Vice Chair Peters. I have to go present a bill, but
good luck.
Continue.
And Vice Chair Peters, if I may, I just wanted to get one more thing on the record that I neglected to do. I just want to let the committee know. The affirmative defenses in this bill are aimed at are aimed at consensual conduct. So the idea that two people engage in activities that may be risky, but people have the right to engage. The scope of it is not intended to extend to other circumstances like a first responder who's responding to a call and wouldn't know if someone had a communicable disease and would not consent to the conduct to transmit the disease had they known that. So I just want to put that on the record. Thank you.
Thank you, I appreciate that. I think we'll go back to support testimony. Go ahead, Ms. Birchie, when you're ready.
Thank you. Good afternoon, Vice Chair Peters and members of the committee. This is Kendra Birchie with the Washoe County Public Defender's Office. Today I'm testifying on behalf of my office as well as the Clark County Public Defender's Office. We want to thank the sponsors for bringing forward this incredibly important bill to allow our state to join the effort of the growing number of states who have modernized their criminal laws to remove these prevention issues from our felony criminal statutes. Just regarding the fact of the misdemeanor, I just want to add that intention is extremely important. And so we believe that this strikes that balance between a status versus a conduct offense. And so it's punishing those intending harm while trying to ensure that those who are innocent actors and may accidentally be caught up in this are not caught up in the criminal laws. We believe that it will help reduce stigma and make prevention issues a public health issues rather than a criminal justice issue. As you've heard, HIV criminalization laws have been shown to be disproportionately impacting women, Black community, and our vulnerable populations. We agree with the statements from the sponsors as to why it's important to decriminalize these issues, why it's necessary, warranted, and justified. Thank you.
Thank you, Ms. Birchie. Seeing no more support testimony in the room, I would ask if there are folks on the Zoom in support. Looking to staff, yes. So if there are folks on the Zoom who are here to testify in support, now would be the time. Not seeing anyone specifically pop up, so if we have some late visual honors, we will come back to you. I will ask BPS to go ahead and open the phone line for those in support of SB 61.
Testify.
Sorry, 375. Sorry, that was my bad. 275. Oh my gosh.
To testify in support of Senate Bill 275, please press *9 now to take your place in the queue. Caller with the last 3 digits, 904. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair and members of the committee. My name is Alex Camberos, and today I'm speaking in support of SB 275. Current Nevada laws regarding HIV criminalization are outdated, ineffective, and discriminatory. These laws were first established decades ago during the height of the HIV/AIDS epidemic when little was known about it. This led to disproportionate marginalization of gender and sexual minorities and communities of color, especially Black people. We cannot punish HIV-positive Nevadans when we have so few state and community resources available to them. This criminalization perpetuates a stigma and discouraging testing, treatment, and disclosure. We should be promoting all methods available to reduce transmission and treatment of HIV. I support SB 275 because it will not modernize Nevada's outdated HIV laws to eliminate stigma and promote public health. If we as a state want to end the HIV epidemic, we should support SB 275. Thank you to Senator Harris for her leadership in presenting this bill, and I thank members of the committee for their consideration. And again, my name is Alex Camberos. That's ALEX-CAM as in Mary, B as in boy, EROS. Thank you.
Thank you for your comments. Next caller in support, please.
The caller with the last 3 digits, 434, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 434, please press *6 to unmute. Okay, I'm going to move on to the next caller. Caller with the last 3 digits, 679. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you. Hello, my name is Connie Rose Shearer, CONNIE ROSE. S-H-E-A-R-E-R. I am a resident of Las Vegas, and I am also a long-term survivor of HIV for 25 years. I'm one of the founding co-chairs for the Nevada HIV Modernization Coalition, and I'm a member of the Advisory Task Force on HIV Exposure Modernization. I'd like to thank the Vice Chair now and all of the Assembly members for taking time today to hear information about this bill. I want to send a huge thank you to Senator David Parks and Senator Dallas Harris for championing this bill for us. And I would like to speak on, I'm here today to talk about why we should all care about reforming the outdated HIV criminalization laws in Nevada. We've made significant advances in our scientific understanding of HIV and the medical interventions available to treat it. Our laws should reflect this progress, and they should not criminalize behavior that poses no risk of transmission. I am what is known as virally suppressed. That means the virus I have inside me is suppressed by the medication I take daily called antiretroviral therapy. There are multiple clinical studies that scientifically prove that I am unable to transmit HIV to someone I'm having a sexual relationship with. And there are also many studies to prove that the people who are transmitting right now are mostly all untested and out of treatment from fear of being criminalized. The way the current laws are written are preventing people from getting tested, which prevents them from getting into treatment that we now know prevents the spread of HIV. We have a fear of being criminalized because not only do convictions for these crimes not require transmission or the specific intent to transmit HIV, most do not even require conduct that could transmit the virus. This includes almost all solicitation and prostitution-related convictions, and nowhere in there does it discuss the fact of how many times I've been falsely accused by people who are leaving a relationship with me and get angry that how dare I, a person living with HIV, leave them, a person who's not living with HIV, to go find something better.
Thank you so much for your testimony.
Again, I will say, I'm sorry?
Sorry, that was 2 minutes. If you have additional testimony you would like to submit in writing, you can submit that to the committee via the email address online. Thank you so much for sharing your story and for your comments. Can we move on to the next caller in support?
Caller with the last three digits, 070. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair and Assembly Committee on Health and Human Services. Thank you for this time. For the record, my name is Jasmine, Jasmin as in Nancy, Margarita, like the drink, and Tobin, T as in Tom, O, B as in boy, O, N as in Nancy. I go by Jazz. I'm an organizer with Planned Parenthood Votes Nevada. Planned Parenthood Votes Nevada is in favor of SB 275. Current Nevada law treats the HIV epidemic as a criminal offense rather than a public health crisis, as all of you have been presented with today. With science and with knowledge, we know better. And so this is our opportunity to do better. Criminalization is not the answer. It never was. Science is. Despite advances in HIV care and science like PrEP, pre-exposure, prophylaxis, and undetectable equals untransmittable, or U equals U, Nevada's HIV criminalization laws are still based on decades-old science. Criminalization discourages testing, treatment, disclosure, and results in stigma and preventable deaths. Whether it's the horribly mismanaged AIDS epidemic in the 1990s or the coronavirus pandemic, BIPOC and LGBTQ plus individuals suffer the most, and they have been the ones leading the movement for justice for their communities. This bill is an act of long overdue justice and aligns with the needs of Nevadans. Please support SB 275. Thank you again for your time.
Thank you for your testimony. We can move on to the next caller in support.
Caller with the last three digits, 130. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Vice Chair and members of the committee. For the record, my name is Christine Saunders. That's CHRISTINE SAUNDERS, Policy Director with the Progressive Leadership Alliance in Nevada, here in support of Senate Bill 275. In the interest of time, I want to echo the sentiments of those who spoke before me and will submit my additional remarks for the record. Our current law causes far more harm than good, increasing the stigma around HIV, discouraging people from seeking testing, and further criminalizing communities of color. SB 275 would help modernize these laws to support modern science and help end the HIV epidemic. HIV is a public health issue, not a criminal issue, and our state laws should reflect that. We urge your support of this legislation. Thank you.
Thank you for your testimony. We can move on to the next caller and support, please.
Caller with the last three digits, 918. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you. My name is Leanne McAllister, Leann McAllister. I am the Executive Director of the Nevada chapter of the American Academy of Pediatrics. Today I offer support on behalf of the Nevada AAP for SB 275. Laws criminalizing HIV exposure and transmission perpetuate the stigma around HIV and discourages people from getting tested. The AAP joins the CDC in calling on states to revise old laws that do not reflect our current understanding of HIV. The Nevada AAP currently has more than 250 members, most of whom are board-certified pediatricians, both primary and specialty care. Members also include pediatric nurse practitioners, physician assistants, pediatric residents, and medical students, all of whom live and work in Nevada and have dedicated their professional lives to the health of all children, adolescents, and young adults. Thank you to Senator Harris for sponsoring SB 275. We encourage all adolescents to talk to their doctor about prevention and getting tested. Thank you.
Thank you for your testimony. We can move on to the next caller and support, please.
Caller with the last three digits, 410. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Vince Collins, VinceCollins. I'm the Director of Community Wellness at the LGBTQ+ Community Center of Southern Nevada. And I also sit on the Governor's Advisory Task Force on HIV exposure and modernization, and it's an honor to do so. Today, I'm offering my support for SB 275 and would like to thank everyone who has contributed to the hard work in getting this bill to where it is today. Also, I want to acknowledge on behalf of over 13,000 persons living with HIV and AIDS in Nevada and the hundreds of newly diagnosed individuals having the courage to live a healthy and meaningful life. For many of these people, the starting point for confirmation of diagnosis and linkage to medical care and other needs, services needs, and their education and as persons living with HIV with organizations such as ours. As an organization that provides free HIV testing and counseling, we rely on accurate and current scientific information provided by the federal government, state, and local leaders to inform our service providers as well as to convey to our clients as to what is true and factual. We need our current laws to be consistent with the science and what is also true and factual. This information needs to be provided throughout the state so everyone better understands their roles and responsibilities and to better address the stigma associated with people living with HIV and AIDS. This bill tries to do so, and I urge you to support it. Thank you very much for your time and your support.
Thank you so much for your testimony. We can move on to the next caller and support, please.
Caller with the last three digits, 016. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. Thank you for hearing this bill. For the record, my name is Wesley Ewell. That's WESLEYJUHL, and I'm the Director of Communications and Outreach for the ACLU of Nevada. We support Senate Bill 275 and the work to take harmful stigma out of our state laws. As a queer man, my experience has always been that discussions about HIV and AIDS are far too often tangled up in homophobia and transphobia, and my sense is that the same is true with Nevada's current criminalization scheme. When looking at the groups most vulnerable to contracting HIV and the groups most vulnerable to criminal enforcement, it's clear it's also tangled up with racial, gender, and economic justice concerns. I encourage you to review the new analysis from the Williams Institute that was presented. I want to repeat that stark racial justice statistic. Black Nevadans make up 40% of those arrested for HIV crimes. I'd also note for you that some of the first volunteer work I ever did was HIV prevention outreach, and we always told the community, get tested and know your status. And the sad truth I hope you see now is that Nevada's criminalization of HIV serves as a major obstacle to these important public health messages because it creates an environment in which people are afraid to be tested. This is a great opportunity to update our laws to align with modern science and to remove the stigma that gets in the way of the work we need to do to address this epidemic. Please listen to community members who are impacted by the HIV epidemic, and please do pass SB 275. Thank you.
Thank you for your testimony. We can move on to the next testimony and support, please.
Caller with the last three digits, 360. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
My name is Sarah Hawkins, S-A-R-A-H, last name H-A-W-K-I-N-S. I'm here testifying today on behalf of Nevada Attorneys for Criminal Justice, or NACJ. Thank you to the committee for the opportunity to speak this afternoon, and thank you especially to Senator Harris and today's presenters for championing this important and impactful legislation. NACJ stands in solidarity with the LGBTQI+ community, their advocates, and community allies. Our position is very simple. We unequivocally support SB 275's passage and urge this committee to do the same. Without compromising public health and safety, SB 275 accords the privacy, protection, care, equality, and human dignity to which all Nevadans are entitled. Please pass SB 275. Thank you.
Thank you for your testimony. We can move on to the next caller and support, please.
Caller with the last three digits, 313. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Dawn, D-A-W-N, Christensen, C-H-R-I-S-T-E-N-S-E-N, Vice President of Communications and Corporate Responsibility for the Nevada Resort Association. Good afternoon, Vice Chair Peters and committee members. Nevada's resort industry has a long-standing commitment to corporate social responsibility programs and initiatives and has a history of leadership in this space. The key pillars of most CSR programs are philanthropy, environmental sustainability, and diversity, equity, and inclusion, which work in tandem to strengthen our community and create better outcomes for people and the planet. Much of our member CSR work focuses on increasing access, opportunity, and equity for all, and it is under this principle of fairness and equality that I speak in support of modernizing HIV laws. We have not had an opportunity to go through the amendment that was recently posted, so we will review that language. But recognizing the overall intent of the bill, I'd like to echo many of the previous comments and agree it's time to update the law. We hope you take into consideration the recommendations presented by the state's HIV Modernization Task Force that helped shape SB 275. In closing, I'd like to thank the bill sponsor, Senator Harris, for her leadership on this legislation and on equality and equity matters. I'd also like to thank Senator Parks for his longtime dedication to LGBTQ equality and his years of hard work in laying the foundation for this bill. Thank you again, Vice Chair and committee members, for the opportunity to speak with you. We appreciate your time.
Thank you for your testimony. BPS, can we move on to the next caller and support, please?
If you have recently joined the call and would like to testify in support of Senate Bill 275, please press star 9 now to take your place in the queue. Caller with the last three digits, 434. Please slowly state and spell your name for the record.
Hi. Can you hear me?
Yes, we can hear you.
Okay, my name is Luis Aceves. I'm the development manager for REACH, Research, Education, and Access for Community Health. We primarily serve the Hispanic, Spanish-speaking population in Southern Nevada. We are in support of the SB 275, which will modernize our HIV laws in Nevada. HIV is not a crime, and our laws should reflect that as soon as possible. Luis Aceves, Luis Aceves, Victor, ES. Thank you, and gracias.
Thank you for your testimony. BPS, can we move on to the next caller and support, please?
Caller with the last three digits, 212. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
My name is Kimmy Cole. That's Kimi,
Cole from Carson City. Thank you, Vice Chair Peters, and to the committee. Understanding of HIV long ago passed original, archaic, inaccurate understandings of an affliction that can be effectively monitored and treated for long-term quality of life. There's a great opportunity here to accurately and effectively recognize scientific understanding of human immunodeficiency virus and to pass legislation that will improve public health while sparing taxpayers the unnecessary burden of paying for onerous and ineffective prosecutions. Laws that have done nothing to mitigate issues that were originally and erroneously intended to help protect society actually accomplish quite the opposite. Almost all of the HIV convictions in Nevada do not involve any conduct that could actually transmit HIV. Outdated laws criminalize an affliction, not actions that cause intentional harm to others. It's time to correct this situation and move on. I urge your support of Senate Bill 275. Thank you.
Thank you so much for your testimony. BPS, do we have any other callers in support at this time?
There are no more callers in support at this time.
All right, we can go to call. I'm not seeing anybody in the room to testify in opposition. Is there anybody on the Zoom in opposition? I don't believe I saw anybody signed up. Okay. BPS, can we open the lines for callers in opposition?
To testify in opposition to Senate Bill 275, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. We can move on to neutral. I'm not seeing anyone in the room here to testify in neutral. Is there anyone on the Zoom to testify in neutral today?
To testify in neutral to Senate Bill 275, please press *9 now to take your place in the queue. Caller with the last 3 digits, 200, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, good afternoon, Chair and members of the committee. Bradley Mayer for the record, BradleyMayer, partner with our dental partners here testifying in neutral today on behalf of the Southern Nevada Health District. I want to thank Senator Parks for his advocacy on this issue over the years and Senator Harris for her extremely hard work, along with the other advocates on updating our HIV laws. As I mentioned in a previous testimony, because of this amendment, because of this bill has an impact on all communicable diseases, we've been working very diligently in several iterations as a working group to make sure that it doesn't impact public health's ability to address those communicable diseases because of us updating this law. So we have proposed an amendment that was submitted on behalf of the Washoe County Health District and Southern Nevada Health District in order to ensure that that's happening, because in Section 1 of the bill, they're looking to add infectious state to the language. And so we proposed some language that allows us to isolate, quarantine, treat, and monitor those in an infectious state. And we made that conforming change to that in Sections 2 and 5 as well for city, county, and local health authorities. And then Section 9 of the bill has an amendment from us that adds language for those who were exposed to communicable disease. And so we really appreciate the work of the committee, the bill sponsor and the advocates on this, and we thank them for working with us. We're going to continue to work with them if there are any additional changes before work session on this bill, and we thank you for your time.
Thank you. If you could hold on the line real quick. Did I lose you already? I just wanted to ask the committee if there were any questions related to the amendment. Seeing none. Assemblyman Ornlicker, please go ahead.
Yeah, and forgive me if I missed it when I was out. I'm curious on page 12 of the amendment, Section 7A, which I read as an exclusion to subsection 4. Subsection 4 sets out who can be held liable for knowingly and intentionally acting in a way to spread their communicable disease, but there's an exception for the person who's donating organs or tissues. Is that because those organs and tissues will be tested anyway, or just curious about that exclusion?
Assemblyman, I would defer to Jennifer Howell if she's still on in regards to that question, because she is the subject matter expert.
Thank you so much. Ms. Howell, if you would like to answer the Assemblyman's question.
Jennifer Howell for the record. Let me take a stab at it. Could you repeat your question for me, please? It's about the donation?
Yeah, so as I read section 4, if you knowingly act in a way to specifically transmit your communicable disease, there is some liability. But section 7A carves out the person who knowingly donates tissues or an organ with the specific intent to transmit their disease. As I read 7A, they're not liable. So is that, now, as I say, presumably their tissues will be tested. So is that why we're carving it out, or what's the theory of carving them out?
My apologies on this. This area of affirmative defense and that kind of thing is not my expertise. Perhaps Brad Sears would be a better person to answer this question.
Yeah, I'm happy to. Thank you, Jen. I'm happy to take a stab at answering the question. It's Brad Sears. And so I guess I would say several things. I think probably the most important is that the chance of actually infecting someone, even if you intended, by donating blood and an organ, is infinitesimally remote. So our blood supply has been extremely well protected. I think the last documented infection of HIV through the blood supply happened well over a decade ago, around 2008 or 2009. The donation of organs quite frequently happens after someone's already passed away, and so there's no prosecution. But you're absolutely correct. In either case, the reason why our blood supply is so safe is that we have testing in the blood supply. The amount of tests of anyone who's alive who's donating an organ would be extensive for the donor and the person receiving the organ. I can also say, since we've done similar analysis now in 5 states, that this type of crime, when it does exist, so for example, existed in California, has almost never been enforced. So it's kind of on the books in some states, but never has any enforcement action. And I guess I'll end with this. There is an affirmative reason to signal that some types of donations are encouraged. For a long time, people with HIV couldn't even donate organs to other people with HIV, even though there's a federal law that calls for that. There's a practice that's been developed that has allowed that to happen. And I know when we repealed that law in California, there was a waiting list of about 40 people in San Francisco with HIV who couldn't get organ donations from other people with HIV until we repealed that law. So there's some positive value in signaling this is an okay thing to do for people in that circumstance.
Thank you, Mr. Sears. I think with that, I can move on to, okay. BPS, could you check the lines for additional neutral testimony, please?
Caller with the last 3 digits, 672, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Nguyen and the Assembly Health and Human Services Committee. For the record, my name is Joelle Gutman-Dodson, JoelleLeGutman-Dodson, here today on behalf of the Washoe County Health District. We are testifying in neutral today. However, we plan to move to full support if and when the friendly amendment proposed earlier today by Bradley Mayer is adopted. We want to thank Senator Harris for her countless hours on this bill, as well as the working group, task force, and of course, former Senator Parks for bringing Nevada into modern times. This bill has been a lot of work for a lot of people working on this important piece of legislation. HIV modernization and decriminalization are priorities, while maintaining the local health district's ability to investigate all communicable diseases as needed to maintain the public health of our communities. Thank you.
Thank you for your testimony, BPS. Can we go to the next caller in neutral, please?
Caller with the last three digits, 978. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Vice Chair Peters and members of the committee. Joanna Jacob, JOANNA-JACOB, Government Affairs Manager for Clark County. We are neutrally supportive. I think at this point we're neutral, testifying neutral today. We engaged on this bill on behalf of Clark County Fire Department. It was specifically on Section 7. In its original form, there was some language in there that we believed would perhaps unintentionally so act as barriers in getting our first responders tested if they are, during their course and scope of their employment, exposed to a communicable disease. Senator Harris, the members of the working group, everybody who worked on this did work with us and in response to our concerns. And before you have an amended version, which we are neutral on. We also appreciate Senator Harris, her clarification that she put onto the record today about the affirmative defenses. We absolutely support the intent of this bill and the move towards decriminalization and approaching communicable diseases from a public health perspective based on accurate and scientific evidence. And that's why we have continued to work on this bill. Wanted to say hello to Senator Parks and thank you for your championship, Senator. It was good to hear your voice again today. And thank you to all who have been involved. We are neutral on the bill. Thank you.
Thank you for your testimony. Broadcast, is there anyone else calling in neutral right now?
Caller with the last three digits, 871. Please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller, you are unmuted on our end, but you appear to still be muted on your end.
Broadcast?
Caller, oh, sorry.
No, that's okay. Please go on.
Caller, please press *6 to unmute.
Hello?
Yes, we can hear you.
Oh, thank you. I'm sorry. I called in support of the bill, and I literally have been sitting here listening to all of it, and my number didn't get called. So can I still testify on support of the bill?
Yes, absolutely. We will just reclassify your testimony as in support. Please go ahead.
Thank you. I greatly appreciate it. Good day. My name is Elisa Howard, for the record. As a former HIV program director and now the owner of Minority Health Consultants, where I still bring HIV health education events to priority populations in Clark County, I am in support of SB 275. As we now have heard several times over, Nevada's laws that criminalize HIV are outdated, ineffective, and discriminatory. The CDC and the state data shows us that HIV has one of the highest mortality and morbidity rates from an infectious disease aside from the latest COVID-19 that threatens the lives of minorities, to include African Americans, Latinx communities, and LGBT communities. Our current laws treat HIV differently from every other communicable disease. It's the only one listed in Nevada's penal code and the only one for which activities that may risk transmission carry a felony charge for the first events. Not only do these laws fail to prevent the spread of HIV, but they also make it harder to end the epidemic by discouraging testing, treatment, and disclosure. As a person who hosts HIV community events in Black communities, discussions, and events, I can testify that the stigma around HIV still hinders these communities greatly from knowing their status and therefore taking care of their overall health. The modernization of this bill will help these communities and the overall state see HIV in alignment with other communicable diseases and not separate, making people living with the virus feel a part of the community and not separate. I thank you for listening and thank you for your time.
Thank you so much. Sorry about our phone line mix-up. That happens every once in a while, but I'm glad we got your testimony in. BPS, is there anyone else calling in to testify in neutral on SB 275?
There are no more callers in neutral at this time.
Oh, well, great. Thank you so much. I would ask the bill sponsor for closing remarks if you have them.
Thank you so much, Vice Chair Peters and members of the committee. It's been a long hearing, so I'll keep this very brief. this is a big one, folks. We have an opportunity to move the ball forward significantly. It's based upon a lot of work by stakeholders, not to mention the HIV Modernization Task Force, which will be renewed again in this legislation in case there are further changes that we need to make in our search for equality. I just want to, again, shout out Senator David Parks for all of his work and what he's done to get us to this point. We would not be here without him in so many ways. So thank you all for your time, and I look forward to seeing you all at the work session.
Thank you so much, Senator Harris, and thank you, Senator Parks, for your continued advocacy for this issue and the issues around LGBTQ plus community. It's so good to see you here. With that, I will close the hearing on SB 275. And I will now open the hearing on SB 305. I see Senator Hammond is here, and I will give him a moment to get set up on the dais, and please, or on the, what is that one called? Oh, the witness table. And please start when you're ready.
Good afternoon, Madam Vice Chair and committee members. I am Senator Scott Hammond, testifying from the witness table. I'm here to present SB 305. I have with me, I hope still, Ms. Rachel Chasen, who is down south in Las Vegas. I know she was at the hospital with her son earlier. She may still be there, but I hope she's still around to provide comments after my brief comments here. SB 305 prohibits certain providers of medical or related services from taking certain actions related to organ transplants solely on the basis of a person's disability. My comments will be brief, and then, again, like I said, I'll turn it over to Rachel. I will tell you 5 things that this bill does, 4 things it does do, and 1 thing that it doesn't do. 1, it prohibits certain providers of medical-related services from taking certain actions of related organ transplants solely on the basis of a person's disability. 2, it authorizes a person aggrieved by the failure of such providers to comply with certain requirements to institute civil action for injunctive or other appropriate relief. 3, it prohibits an insurer from taking certain actions related to an organ transplant because the insured is a person with a disability. 4, it prevents a provider of healthcare services from not placing a person with a disability on a transplant list or placing a patient low on the transplant list because of their disability. And then the last thing that it does not do, SB 305, Senate Bill 305 does not take away a physician's ability to diagnose a patient and determine whether or not the patient is eligible or a good fit for a particular organ transplant. We are attempting to ensure people with disabilities, whether intellectual or cognitive, are not denied an organ transplant because of their disability. And if it would please the Vice Chair, I would then turn over my time to Ms. Chasen if she's down south. I hope she's on.
Thank you. I did see Ms. Chasen. There she is. Thank you. Please go ahead when you're ready.
Hi, everyone. Good afternoon, Ms. Chairwoman, members of the committee. My name is Rachel Chesson, and I'm excited to be here today.
Ms. Chesson, we are having a really difficult time hearing you. There's a lot of static on your line. I don't know. Maybe you're using a set of headphones. No, that's still pretty bad. BPS, can you step in and see if we can troubleshoot this for Ms. Chesson, please?
Hey there, can you guys hear me better now?
Yes, that's
Perfect.
great. Thank you so much. Please proceed.
Awesome. Thank you guys so much. So sorry about that. Thank you so much for being here today, you guys. Sorry, let me just get back to my notes. My name is Rachel Chesson, and I am excited to be here today in support of SB 305, Caleb's Law. Just some background on me. I was born and raised here in the Las Vegas community. I'm the Community Engagement Director at the Just One Project, which is a local nonprofit here in town, and I'm a fierce disability advocate. I share our journey via Instagram and on Facebook at a little extra and on a little extra love.com, which kind of just tells a little bit about why I love Caleb's Law and why we're passing it and trying to get this to happen. I'm here because I'd really like to tell you guys about my son, Caleb. He is 22 years old. He's happy, healthy, and extraordinary in every way. He goes to preschool part-time. He hangs out with his grandma on the weekends. He's learning sign language, loves to go to the park, and participates in brand campaigns emphasizing inclusion throughout the community. And Caleb also happens to have a third copy on his 21st chromosome, or Down syndrome, or what I like to call his extra love that makes him exactly who he is. I like him a lot, and he is amazing. And he is literally the best thing that ever happened to me. Because of his diagnosis, I've been an active member of the disability community for a couple of years now. And within the community, there was a story that I heard that absolutely stood out to me as being almost unbelievable. It was a story about a little girl named Ellie, not even a year old, living with her family in Ohio and in need of a heart. The doctors told Ellie's mom Ellie wasn't eligible for a heart transplant, not because she was too sick or because of any medically significant reason. She wasn't eligible for a transplant simply because she had an intellectual disability. Her life was not worth saving because of an extra chromosome. When I heard Ellie's story, I immediately assumed it must be an anomaly, a one-off, some rogue group of doctors acting outside the typical standard of care. What I found, though, was much worse. Story after story, a 10-year-old boy named Leaf in Oregon denied a transplant because he has autism. Amelia Rivera, a 3-year-old, denied a kidney in Pennsylvania because she has Wolff-Hirschhorn syndrome. 5-month-old named Maverick denied a heart in New York because of another rare chromosomal disorder similar to Down syndrome. And that's when it hit me. My son Caleb is perfectly healthy now, no medical concerns to speak of other than some trouble from being born premature that he has grown out of. And if he needed an organ transplant tomorrow, it would be because of an accident or trauma. It would have absolutely nothing to do with his diagnosis of Down syndrome. Yet studies show 85% of pediatric transplant centers would take Caleb's intellectual and disability into account. 71% of heart programs indicate that even mild or moderate cognitive impairment is enough to disqualify him from the organ transplant list. And a survey showed that transplant centers always or usually considered IDDD diagnoses when deciding eligibility for transplantation. 52% of people with IDDD receive a referral for a specialist evaluation, and 33% of those 52% who are referred are never evaluated. Story after story, and it again happened just in February of 2019 at the University of North Carolina. They were forced to resolve an investigation by the U.S. Department of Health and Human Services after they denied someone a heart transplant simply because he had a learning disability. And when their action were challenged, UNC immediately reversed course, with DHH issuing this statement. The director of the Office of Civil Rights, Roger Severino, said, and I quote, "Every life is precious, and no one should be blocked from access to an organ transplant because of stereotypes about persons with disabilities. It is also against the law." And that's an important point. The reason I'm here today is for support to ban organ transplant discrimination here in Nevada, but we are not asking the state to do anything new. Discrimination in medical services is already illegal under the Federal Americans with Disability Act. The problem is enforcement. There's no easy way for you or me to enforce the ADA because it has no mechanism for enforcement. So in practical terms, that leaves us, the state of Nevada, on our own to not just prevent discrimination, but to give people an effective way to challenge discrimination when and where it happens. And that's where Caleb's Law comes in. Caleb's Law clarifies that doctors, hospital transplants, and other healthcare providers are prohibited from denying access to necessary organ transplants solely on the basis of qualified individuals' disability. We require that health providers considering evaluating the likelihood of a transplant success, the full range of supports available to help a person with a disability manage their post-operative care, includes a fast-track procedure for challenging discrimination to ensure that people in urgent need of an organ transplant can obtain timely resolutions to their claim, And the best news is I've already reached out to doctors all over the state, the heads of multiple transplant centers throughout the country, and even the American Heart Association and the Children's Heart Center of Nevada and Opportunity Village. And I'm pleased to say today, I've not heard one word of opposition to this bill, none. Overwhelmingly, even from the medical community, the response seems to be one of understanding. This is a bill that represents a significant step forward in the protection of people with disabilities in the state of Nevada, and it should be passed. And one last thing, because I know I've already taken up too much of your time, 15 states have already passed similar laws to this, and another 13 states have similar bills pending here in 2021 right now. In almost every instance, though, those bills were proposed because someone with a disability was in desperate and immediate need of a life-saving transplant and was facing unfair discrimination. It's my hope that we do not wait for a similar story here in Nevada. It's my hope that you can support us in passing Caleb's law. Thank you guys so much, and if you have any questions, please let me know.
Thank you, Ms. Chesson, and thank you for sharing your story with Caleb and others. We really appreciate you being here to do that and for bringing this bill. Senator Hammond, do you have additional comments before we move on to questions?
Madam Vice Chair, no, I do not. I'm ready for questions and any other, and I think Rachel as well.
Great. I have the first question from Assemblywoman Benitez Thompson, please.
Thank you so much. And so I'm wondering, you've got a reference to the supported decision-making language in here, meaning make sure that the helpers that we acknowledge in law are able to help a person should they need that. And the only thought I had was, and this might be more of a question from legal, this specific NRS reference looks pretty specific to just the supported helpers, but I'm wondering if it would encapsulate to NRS 162A, which is the power of attorney for adults with intellectual disabilities. So once again, just having that other place in statute where we acknowledge helpers who are helping our ID community.
This is Senator Hammond for the record. Through you, Madam Vice Chair, to Assemblywoman Benitez Thompson.
Please feel free to go directly to the member.
Thank you, I will. Assemblywoman Benitez Thompson, I think it is a good question, I think, for legal, because what we're looking at is to make sure that when there is an occasion where there's a transplant, that person then has help if the parents aren't available, that they have somebody there. Whoever your legal staff is, and I apologize, when I wear the mask, I can't wear my glasses at the same time, so I don't see names or titles.
No, thank you. I appreciate that. And so that's good. So for intent, we want it. And then I guess we'll let legal know if we get that. Because for the over 18, we know we've passed some bills in the legislature to make sure that adults with intellectual disabilities weren't having to always surrender their civil rights in order to go to a dentist, right, to sign off on permission for anesthesia. And so that's just another place in the law where we have helpers identified in making healthcare decisions. So unless someone tells me it's contrary, I was just thinking it'd be good to have those places where we reference such things in the same spirit of supporting it.
Absolutely agree with you. Thank you very much. Senator Hammond for the record.
Thank you, Senator. We did have Carly O'Krent, our legal, on for a minute if she'd like to respond.
Hi, can you hear me?
Yes, please go ahead.
Carly O'Krent for the record. I think I noted what Assemblywoman Benitez Thompson had mentioned, and I'm happy to look into that and work with her and the committee to ensure that the bill addresses those circumstances.
Great, thank you so much. And if we don't mind getting that to the rest of the committee, that would be helpful as well. Next on the list of questions, I have Assemblywoman Thomas, please.
Thank you, Vice Chair. And thank you, Senator Hammond, for bringing this bill forward, Caleb's Law. Caleb is a beautiful child. Thank you so much for his mom for sharing his story. My question is, how often are people with disabilities experiencing this type of discrimination?
Assemblywoman Thomas, I think I'd rather defer to Ms. Chasen, she's still on the line. I don't know if I have that information readily available. And there she is. And don't
Hi
forget
there.
Don't forget to state your name before you speak, Rachel.
Hi there, Rachel Chesson for the record. Assemblywoman, thank you so much for the question. I am pretty positive that it happens quite often. We have stories after stories within our disability community and specifically in the Down syndrome community. And that's why this law is like sweeping the country by a storm right now, just because it is happening so often within the within the country.
And to follow up, if I could.
Thank you guys so much.
What I'll do is I'll check in and make sure I get an exact number for you and report back to the committee. This is Senator Hammer for the record.
Thank you, sir. That was my second question. Thank you.
Thank you, Senator, and thank you, Ms. Chesson. Next, I have Assemblyman Ornlicker.
Thank you to Vice Chair and David Ornlicker, Assembly District 20 for the record. My question is along the lines of Assemblywoman Benitez Thompson and thinking about other circumstances in which there could be discrimination. And as you observe the problem, or as Ms. Chesson observed, the Americans with Disabilities Act prohibits this kind of thing, but there's no enforcement. So it strikes me there are probably other kinds of discrimination prohibited by the ADA that there's no private right of action for either. And it would be nice if we address those as well so that we pick up more. I know it's hard to change people's bills, but if we've got this vehicle to make sure there's always a private right of action for people who are discriminated under the ADA, that would be a nice thing to do.
Assemblyman Ornlicker, this is Senator Hammer for the record. I completely agree. I don't know if you have language in mind or if we have an exhaustive list, but I'd certainly welcome a conversation with you about this.
Thank you. I'll follow up.
Thank you for the question. Are there any other questions from the committee? Seeing none, I think we are ready to move on to support testimony. I do not see anybody in the room here in person for support testimony, so I'd ask BPS to go ahead and open the lines for support testimony for SB 305.
To testify in support of Senate Bill 305, please press *9 now to take your place in the queue. Caller with the last 3 digits, 377. Please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 377. Please press *6 to unmute.
Good afternoon, Vice Chair and committee members. Can you hear me?
Yes, we can hear you.
Hi, good afternoon. My name is Dr. Tani Forlini. That's Tahnee, last name F as in Frank, Orlini. I am a board-certified clinical pharmacist specializing in emergency medicine here in Las Vegas. And I am also the mother to an amazing little boy who just happens to have trisomy 21 or Down syndrome. And I'm speaking to you today in support of Senate Bill 305 for the equal access of organ transplants to individuals with disabilities. For centuries, individuals with physical and intellectual disabilities have been discriminated against. Individuals in this country have been institutionalized and neglected as recently as the 1970s. And disability rights have come a long way since the passing of the Americans with Disabilities Act in 1990, but the struggle continues. From access to equal education rights, job opportunities, and quality health care, much work still needs to be done. Senate Bill 305 is a step in the right direction in allowing all individuals the same access to life-saving transplants. Individuals with disabilities have fulfilling lives filled with joy and love and family and support. This bill helps ensure they receive the same care and consideration as anyone else in our community and needs to be passed as it supports basic human rights and ensures that people like my son will have a chance to live the lives they are so deserving of and that so many of us continue to fight for. I thank you all for your time.
Thank you for your testimony. Broadcast, would you please go ahead with the next caller in support?
There are no more callers in support at this time.
Great. I think we can move into opposition testimony, and seeing none in the room, broadcast, would you please open the lines for opposition testimony to SB 305?
To testify in opposition to Senate Bill 305, please press *9 now to take your place in the queue. There are no callers in opposition at this time.
Thank you. I'm not seeing anybody in person for testimony in neutral, so I'd ask BPS to open the lines for testimony in neutral.
If you would like to testify in neutral to Senate Bill 305, please press *9 now to take your place in the queue. There are no callers in neutral at this time.
Thank you. And with that, would invite the bill sponsor to make some closing remarks, please.
I'll be brief. I thank you for your time and for your questions, and I'd be willing to take any kind of conversation offline. Thank you.
Thank you so much. And thank you, Ms. Chasen, for your testimony as well and your advocacy on this bill. With that, I will close the hearing on SB 305. And we will move on to our next agenda item. Last of the day for public comment. We can begin public comment. As a reminder, to provide comment by phone, you must register online at the legislative website. Information is also available on our agenda, and registrants will receive a phone number, meeting ID, and instructions to join the meeting. Please remember to clearly state and spell your name and limit your comments to 2 minutes. And seeing no one in the room for public testimony, I would ask BPS to open the lines for public testimony, please.
Chair, the public lines are open and working, but there are no callers on the line to testify or for public comment at this time.
Thank you. With that, are there any comments from members before we adjourn? Seeing none, that concludes our meeting for today. We will see you on Wednesday. Meeting is adjourned.